Okay, things to know. I'm gonna just explain. Basically, I'm telling you what you need to memorize here. Primary and secondary brain vesicles. Its first two slides of the presentation just lists you telencephalon, diencephalon, mesencephalon, so on and so forth. And what they develop into. Mesencephalon develops into metencephalon. Myelencephalon develops into medulla oblongata. Okay, stuff like that. Moving on. First sort of associate structure of the brain that we need to learn, the concept of cerebrospinal fluid. Functionally, it floats the brain. There are going to be some ideas that are not clear from the first glance. Does that make sense? But I'm going to lay out cerebrospinal fluid and brain meninges next to each other. There's a lot of conversation between those two, so these ideas will become clear as we move on. Floats the brain. It's produced in so-called choroid plexuses. How it is produced? Ependymal cells, you may remember we talked about them as one type of glial cells. They filter blood. Essentially, ependymal cells allow fluid, plasma basically. They filter out, they're leaving behind cells, they're leaving behind large proteins, but smaller molecules like glucose and amino acids can actually get into the cerebrospinal fluid and provide some nutritional support to the brain. You produce I believe about 500 mils, you don't need to memorize the number, of CSF per day, but the volume that you have at any given moment is about 150 mils. So it's got to drain. Cerebrospinal fluid drains into arachnoid villi. Okay? Now, CSF fills, I know that terms like what the hell is arachnoid villus? What the hell is subarachnoid space? Arachnoid space. And the ventricles. Now, show some patience. We're gonna learn what arachnoid villi and subarachnoid space are. For now, I want to introduce the concept of ventricles. So imagine your brain right here. Your brain being placed in the cranium. Cranium is a bone, right? If you put this really soft tissue, well, not plastic, but real brain, in the bony cranium and just leave it there, it's going to get beaten really bad, right? So you need to somehow fix it there. One set of structures that fixes the brain are meninges, which we will talk about next. And another thing that floats the brain and reduces its weight is cerebrospinal fluid. So it flows around the brain and around the spinal cord. Does that make sense? but it is produced by these choroid plexuses and the structures that are called ventricles. So this gray structure is a ventricles. And this is kind of a weird explanation. In real life, ventricles are just empty spaces. Does that make sense? Imagine that somehow we replaced cerebrospinal fluid with the liquid plastic. Are you following me? Liquid plastic. This liquid plastic takes the space of cerebrospinal fluid and then solidifies. You remove all the brain tissue and this is what you see. This is the plastic that has solidified inside the ventricles. Does it make sense? This is, okay. I kind of see like, I'm not sure about that. So, if you will fill your mouth with plastic that will solidify, you're going to have a blob that takes the shape of whatever's empty in your mouth. Does that make sense to you, Rhonda? Good? Same story here. This model shows you the shape of the actual empty cavities. Okay? This is how they're shaped. So, there are 4 ventricles. There are 2 lateral ventricles. You're looking at them from the front side. So if they are my ventricles, this is going to be the right one. And this is going to be the left lateral ventricle. They are the largest. Each lateral ventricle has 3 horns: ventral, dorsal, and inferior. Okay? You can see right about here the pink spots. They represent choroid plexuses. This is where cerebrospinal fluid is produced. Lateral ventricles are connected to the 3rd ventricle, right here. That's the 3rd ventricle. By little connections, you can see them on the models. These connections are called interventricular foramen. The term foramen in general refers to the opening. This one in the back is so-called 4th ventricle. 3rd and 4th ventricle are connected by cerebral aqueduct. So this little tube here is the cerebral aqueduct. And then from the 4th ventricle, cerebrospinal fluid finds its way to float the brain, to move around, to flow around the brain, to flow around the spinal cord and actually within the spinal cord. So far we good? Now, here's one disease associated with the cerebrospinal fluid. I'm going to put it in pink, in red. Red is better. So when drainage is impaired, for instance, somebody has a trauma or tumor or some other structural problem with arachnoid villi, okay? Does that make sense? It results in a condition known as hydrocephalus. So your cerebrospinal fluid accumulates in all parts, in ventricles, in subarachnoid space, and compresses the brain, okay? Who do you think, if hydrocephalus happens, we would compare an adult with a hydrocephalus and an infant with a hydrocephalus, in which cohort of patients this condition will be more dangerous? In adults or in newborns?
Newborn.
can our skulls expand?
Oh, so would be
Yes, they have soft skulls, they have fontanelles. So in newborn, I mean, I'm not saying that we don't have to treat them, but in an adult, skull is absolutely rigid, so all pressure will be directed onto the brain. In an infant, the soft skull will give in to pressure, so it's sort of less dangerous. The treatment is pretty simple. What do you think we do? Drill a hole, yeah, and drain it. I mean, of course, people don't walk around with a hole in their skull. They insert a little tube, and if you can't fix the problem, the drainage will be installed in a way so that excessive cerebrospinal fluid will be drained into the abdomen.
Don't they do like a shunt or something?
You can do it. If you can fix it, then it's going to be temporary. But it's a shunt that in people where you can't fix it, it will be drained into the abdomen. Okay? Because it absorbs there very easily. Didn't mention, just a little note. So drains into arachnoid villi into where? Into the blood. Okay? So it comes from the blood and it goes back into the blood. I told you that a lot of these new terms will start making sense when we will be talking about meninges, and this is what we're going to do now. Meninges are essentially layers of connective tissue that support and partition the brain. So we, as all good people, are going to start with an outermost layer of meninges that is called outermost, so outer layer. It's called dura mater. Dura means sturdy. Okay? So dura mater itself can be kind of separated into two sublayers. So-called periosteal layer and meningeal layer. Good so far? So what's the difference? Periosteal layer attaches to the bone, to the skull. So skull is right here. Meningeal layer attaches to the lower layers of, meninges, other meninges. Say it again.
You say the top one.
So look, you've got two layers. Usually they're like this. Okay? My right hand represents periosteal layer. Good? Here will be the skull. My left hand represents meningeal layer. Under it will be next meninge. Next layer of meninges.
I got you.
Good? Clear? Okay. So, why I separated them by quite a substantial space? When these two layers, sometimes they become separated like this. Do you see the lumen between that they form? In that lumen, you're going to find venous sinus. This is vein. This is just a vein. It's a weird vein. It is not, if you do a cross section, it isn't round. Are you following me? It's more like triangular. Okay, that's all. It's just it's a normal vein. It collects blood from the brain. We good? Nothing fancy about it. Next layer here. Arachnoid matter. Okay, middle. And then here, the innermost layer, pia matter. Good so far? Now, you see, so first of all, is there space here between the dura mater and the arachnoid matter? A little bit. A little bit. This space sometimes referred to as subdural. But it's not particularly important. The space that really is important is located right here. And this is so-called subarachnoid space. Why it is important? It contains two crucial things. This is where CSF flows. By the way, so when we talk about when we talk about cerebrospinal fluid that flows around the brain and supports it, okay? It is in this space. You may ask, how big is this space? Take a penny and look at it from the side. That's the approximate thickness. It's very, very thin. Okay? Very narrow. Second thing that is located here are blood vessels. Basically, all of the blood vessels that supply the brain are in subarachnoid space. Does that make sense to you? And, well, pia matter, yeah, it clings to the brain. So here you have the brain. Okay, we're good so far? Moving on. Moving on? Okay, cool. So first, let me kind of recite it one more time. So imagine you have a drill with well, not really a long drill bit, and you start drilling through the skull. So drilling through the skull, you hit periosteal layer. Okay? First, over dura mater. Then, you may or may not hit a venous sinus. Like, if you will drill right here in the middle, you will. If you step aside, you won't. Then you hit meningeal layer, and then you penetrate really narrow subdural space, hit arachnoid matter. That makes sense? Now, see this arachnoid villi? So arachnoid villi, essentially, these little drainage structures that get into the venous sinus and drain CSF into the blood here. Okay? So you go through arachnoid matter, you hit subarachnoid space. At this point, CSF starts kind of sprinkling out of the hole that you're making in somebody's head. Does that make sense? Starts leaking. You may or may not hit a blood vessel, and then you hit pia matter, which is super thin, and you are in the brain. This is basically the order of how this thing goes. Does that make sense? Now, yesterday I did I consider it a smart move. Instead of packing all the diseases at the end, I kind of gave some relevant conditions at each step of an explanation, okay? So things that we're going to talk about now are pretty exciting. It's concussion. I'm not going to kind of explain contusion of the brain. traumatic brain injury, well, okay, technically speaking, look, technically speaking, both of these two are TBI. Concussion and contusion are traumatic brain injury, right?
So you would label these as what, like, which for the topic?
Can't hear
They're
you.
not really diseases, but they're like.
Pathological conditions, let's put them this way, yeah.
Okay.
So, basically, traumatic brain injury happens when you hit the brain, right? So,
But isn't it really hard to get to the brain?
no, it's super easy.
Really?
Well, relatively. So, concussion. You have that thin layer of cerebrospinal fluid that supports and protects the brain. Does that make sense? Imagine that you are a football player, and let me give you a perspective. So people who fly fighter jets, they experience the accelerations and decelerations 5G. You're familiar with G, the free fall, right? People who take off in a rocket, in a spaceship, experience 8G. A simple contact between the head of a professional football player, like a linebacker that makes not too clean of a tackle, okay? At full speed, the brain can experience 35G. There is not enough CSF in the world to prevent the brain from hitting the skull. Does that make sense? If it hits noticeable, and there are two kinds of injuries, it can, so basically cranium stops, but brain doesn't, so cranium hits the cranium, bounces back, hits the back of the cranium. Coup and counter-coup injury. Does that make sense? Now, these little concussions, microconcussions, happen all the time. So basically, when you're watching football, remember, watching 22 millionaires receiving traumatic brain injury every second. Okay? TBI concussions are cumulative because brain is not very good at repairing itself. Concussions occur not only in the brain, obviously they occur a lot in boxing, they occur even in soccer, and people do headers. This is why United States Youth Soccer Federation prohibits players until the age of 12 to do headers because it really impacts the brain development, okay? What's the main problem? Contusion is bruising. What's the main problem in both cases? You have injury, you have inflammation, you have swelling, you have increased intracranial pressure. Okay? If you don't relieve it, if you don't watch it, it can really impact the function of the brain. In some cases, traumatic brain injury may result in the damage to the blood vessels in subarachnoid space. They start leak. Okay? You get subarachnoid hematoma. Sometimes they actually leak in subdural space, you get subdural hematoma. Hematoma is accumulation of blood. Increased pressure again. Poster death. From this is the wife of actor Liam Neeson, who had traumatic brain injury while downhill skiing. She did not know, and she felt fine. 2 hours later, she was dead. This happens extremely quick. This is why, injuries to the head are no joke. They have to be evaluated by the profession. Okay. Now, a couple more conditions associated with these blood vessels. It's going to be stroke. So what is stroke? Problem with the blood vessels in the head. There are two types. There is ischemic stroke, and there is hemorrhagic stroke. You may ask, what's the difference between the stroke and, say, subarachnoid hematoma? Subarachnoid hematoma is the result of this, the hit to the head. Does that make sense? Stroke results from within the blood vessel. So ischemic strokes are more common. It's about 70%. Don't memorize the number. Stroke by itself represents the 5th cause of death in the United States after cardiac disease, cancer, COPD, and diabetes. Okay. So in ischemic stroke, you have a blood clot formed somewhere in the body. Most frequently, large veins of the legs, so-called deep vein thrombosis or peripheral thrombosis, or atria of the heart in people with atrial fibrillation. Moves around the circulatory system, finds its way through the vertebral artery, vertebral or basilar artery, into the circulatory system of the brain, circle of Willis, and then, God knows, it gets stuck. Does that make sense? It blocks the blood flow. The bigger the brain, the worse. The bigger the clot, the worse. Okay, if it blocks large enough artery, a huge chunk of brain loses oxygen supply. Neurons cannot do anaerobic. They just can't. And they die. And they can't repair. Okay, so that's it. Make sense? Hemorrhagic stroke is more common in people with hypertension. When people have serious hypertension, okay, when they have really poorly controlled hypertension, the blood vessels change structurally. And many of them develop what's called aneurysm. So it's like, if you're familiar with pipes, it's a pipe, and suddenly the walls in one particular place are very, very thin. So all you need is a good old spike in the blood pressure, and it explodes, and there you go. Ever heard about the bloodletting, the old cure? That's viable practice, because if you have a person with hypertension has a spike in the blood pressure, by doing bloodletting you at least drop the blood pressure. So maybe aneurysm will not pop. Okay? Go ahead.
I had an aneurysm when I was 11.
Ooh. Good.
I know.
It was probably noticed relatively fast, I suppose? Nope.
I was having real bad headaches. I was going swimming every day. I thought it was just for me hitting because I was diving.
Oh.
And then, nothing. Then it swelled up and it pressed on my optical nerve and it closed my eye. Then they admitted me. It took them 18 days to find it because I was the first child to have an aneurysm. So
Wow.
That's
but
remarkable.
They brought a specialist in from New York to do the surgery.
That's remarkable.
Yeah, and they told my mom the severity of it. She had a nervous breakdown and they admitted her 2 floors up.
This is quite a story.
Oh yeah.
No, but I don't. Probably the blood vessel was not too big.
Yeah, it was. Yeah.
I used to know a woman who had massive aneurysm in one of the key arteries, and she spent several years basically learning how to speak and walk, and it was a miracle that she. But it was like sudden. Yours was more extended in time, I suppose. But that's super interesting.
And it also started before it swelled up on my optical nerve. It started. They said it started draining a little bit to my stomach, and I was like projectile vomiting everything I ate.
Ooh.
Yeah. So that was the first thing that sent me to the doctor was projectile vomiting.
And then
the swelling, and it closed my eye, and it was like, that's not normal. Let's admit you. And like I said, it took them 18 days to find it, but they did the surgery, and I was home on the 21st. So.
well, I'm glad that it.
Yeah.
This is why you're here.
Right.
Okay. Any questions here? This stuff. Okay.